na Nyuni Kisaka. Ni mmoja wa viongozi wa Tausi. Ninasimamia Pacific Chapter na nimekuwa kiongozi kwa takriban miaka 3 sasa. Basi kwa namna hiyo nipende kuwakaribisha katika muda mzuri sana wa masaa machache ambayo nitakuwa nikisimamia. Ninapenda kumkaribisha dada Sule kwa wimbo. Tafadhali Sule, karibu.
Chama cha Watanzania wa Adventista wa Sabato waishio nchini Marekani,
yaani Tausi,
wanakuletea
22 sasa, hiyo miaka ya huduma ya Tausi.
Tangu kuanzishwa kwake,
mkubwa umeandaliwa
nchini Marekani
kwa ajili yetu sote. Imani, Bwana utuongeze imani. Twaenenda kwa imani, si kwa kuona.
Ni imani tukubwa,
nataka imani hiyo imara, ambayo haitetemi kitu chochote. Karibisha wote kwa mkutano huu, tushiriki baraka zake Bwana.
Mkutano huu wa kitaifa ulioandaliwa na Tausi utendeshwa kwa njia ya mitandao ya kijamii ya Zoom, YouTube, WhatsApp, Facebook na mitandao mingine ya kijamii. Ni kuanzia tarehe 7 hadi tarehe 10 ya mwezi wa 7, yani Julai mwaka 2021. Huku wahudumu wako katika mkutano huu akiwa ni pamoja na mchungaji Geoffrey Mbwana kutoka makao makuu ya kanisa la Waadventista wa Sabato ulimwenguni nchini Marekani, pamoja na mtumishi wa Mungu mchungaji Aston Mambo kutoka Tanzania, wakishirikiana na kwaya ya vijana Nyarugusu kutoka Geita, Tanzania. Bwana tuongezee imani, ndilo neno kuu katika mkutano huu. Jiandae kubarikiwa.
Amina. Asante dada Sule Maduhu kwa utangulizi huo. Hakika Bwana tuongezee imani. Kwa kipindi kinachofuata sasa tutakuwa na Dr. Peter Luyeho ambaye atakuwa anaongelea kuhusu medication and your body. Tunamkaribisha Dr. Peter Luyeho. Tafadhali karibu.
Asante sana. Very nice to be here. Tunamshukuru Mwenyezi Mungu. I am so excited, very excited to be here today. Nimefurahi na tunamshukuru Mungu. Not too long ago, miezi 3 iliyopita, we had tulikuwa na wagonjwa 1250 hospitalini ambao wote walikuwa na COVID, na leo tuna mmoja tu ambaye ana COVID lakini hospitali imejaa. So maombi anafanya kazi, and we thank the Lord tremendously. Let me share my screen. I wonder if everyone, unaweza kuona screen yangu? All right. Leo nina wageni, nina wanafunzi residents na pia wanafunzi wa medical school na madaktari wamenijoin. Kwa hivyo hawawezi kuelewa Kiswahili, so nitaongea kwa Kiingereza at least so they can get something out of this. So I will be talking about medications and your body. A very broad topic, but I hope I will be able to cover some salient features today. And at the end of this talk, hopefully all of us are blessed and able to make some changes to maybe what we think about medications and overall to our health in particular. Why do we need medicine? it is a very tough situation when a patient comes to me and I see them and they say, Doc, you want to give me medications? What have I done to deserve being on medications? I don't think anyone among us wishes to be on medication on a regular basis. We don't wake up and say, please, I just want to be on medications. So, story is told in John chapter 9, verse 1 to 12, of a blind man who was, who Jesus and his disciples met. And there was some interrogation of this blind man and some discussion among the disciples and the people definitely who are close to Jesus. Why is this person blind? What happened to him for him to be blind? Because he was born blind, as John chapter 9 tells us. And Jesus' answer was, neither this man nor his parents sinned, but this happened so that the works of God might be displayed in him. So kwa wale ambao tukiwa diagnosed na magonjwa ama one particular disease, tunafikiria tumefanya nini, either kupata diabetes ama hypertension. For the most part, I don't want any person leaving this talk or even thinking that they are sick because of something that they did. Yes, there's a role that some of the diseases have in terms of our lifestyle. However, there are many diseases that come to us. For example, hypertension. It's called essential hypertension. Nothing that anyone has done caused the hypertension. It's just because we are African Americans, we are Black, our incidence of hypertension is extremely high. And it just so happens that we have hypertension. So this happened so that the works of God might be displayed in the person who was blind. So medications, what are they and where are they derived from? So plants have been used for quite some time, many, many years ago, including the herbalist Hippocrates. He used St. John's wort. Kwa Kiswahili, I'm not sure what St. John's wort is. I tried calling my aunt and I didn't find an answer. St. John's wort, but it's used to treat depression. It is a naturally occurring plant, and it's used to treat depression. So for many years, actually medications have been derived from plants. Now, of late in the US, herbal supplements. What is an herbal supplement? We have vitamins, we have herbs, a lot of stuff you'll find out there, amino acids, some extracts, some concentrates. They were not really regulated, and the use of dietary supplements, which encompasses all amino acids, vitamins, etc., has skyrocketed. About in the year 1990, about 2% of Americans were using herbal supplements. By 1997, that had got to almost 7.5%. And now, presently, they say some estimates are 25% of US residents use dietary supplements on a regular basis. And it's, it's a fad. Some folks, everyone at work is using it, so you also buy a multivitamin and start using. So prior to 1962, really the marketing industry with regards to the drug industry, and I'm talking about medicinal drugs. I'm not talking about cocaine and heroin, etc. Medicinal drugs. There was no really oversight by the government. And if you read the US history, there's history of patients being born in the 1950s and 60s. And you'll find or see when you go grocery shopping, etc., some people with limbs, especially arms, that are deformed. And there was a medication called thalidomide that was being used at that time. And no one had really studied it because there were no government regulations with regard to safety of medication. So in 1962, the US government actually came up with an agency that all medications used for medicinal purposes have to undergo safety, efficacy, and there's an organization that looks over it, an agency, a government agency. That's why, for example, the vaccinations that we are currently using, Moderna, J&J, and Pfizer, are just approved emergently. They are still going through the process. So it's quite a strict process that medications are subjected to, or pharmaceutical companies. The dietary supplements, however, had no oversight whatsoever. So individuals were adulterating these herbal supplements. Adulteration means adding ingredients, for example, to a vitamin to make it more, to concentrate it, or in so doing, increase the amount you have. So there was no oversight whatsoever. So at least now, this Health Act that was established in the 1990s has some oversight over the dietary supplement industry. So when you go to the grocery store, drugstore, i.e. pharmacy, you'll find the vitamin section, the dietary supplement section. The vitamins have to be clearly labeled, but again, they're not required to list any adverse events, side effects. Those are they're not required to list them. So the dietary supplement industry, in essence, it's out there with some oversight, but not a strict oversight to medicinal medications. So patients very frequently tell me, they come in, I diagnose them with extremely high blood pressure, and we have to start something. I say, why don't you want this medication I'm about to start you on? Well, doctor, I've heard medications are dangerous. They are full of, they're chemicals. I don't want to take a chemical. I am very weary of taking a chemical into my body. And that is the main discussion I have with patients who are very hesitant to take medications. So this is just a sample of some of the common medications, or maybe not so common medications we take or are prescribed. So all these are prescription medications. I would like us to go through them one at a time. Atropine. When you go see an ophthalmologist or an optometrist, and you have a dilated eye exam, the eye actually use atropine to dilate your eye. Atropine is also used, for example, in a patient whose heart rate dips severely down. We use it in the hospital. So this is not actually a medication for all that we prescribe and send you home with. However, it is derived from the herb belladonna plant. Codeine is used for pain. It's an ingredient in some pain medication. That is a prescribed medication, and that's derived from the poppy plant. Colchicine, that's a medication used for gout, for an acute gout flare, and also for continued suppression of gout. And that is also derived from a plant. Digoxin, used for the heart. Ephedrine, so you'll run into the pharmacy and your nose is, you feel as you have a cold. Ephedrine that you use is from ephedra. That's also a plant. Cholesterol. In this country, I believe we have a crisis of hyperlipidemia, high cholesterol levels. And there are multiple medications that can be used, lovastatin being one among many. That is actually derived from a plant. Penicillin, as we all know, the old antibiotic, is from a penicillin mold. And the list goes on and on. The last two, Taxol and vincristine. Taxol is actually a chemotherapy agent. Vincristine is also a chemotherapy agent. Taxol is used to treat ovarian cancer, breast cancer, etc. That is actually derived from a plant, Pacific yew. Vincristine used to treat leukemia. That is actually derived from a Madagascar periwinkle. So as you can see from this sampling, many medications that are actually prescribed by a physician, by the physician assistant, nurse practitioners, are actually derived from plants. So the notion that all medications are chemicals and dangerous to the body I think that has to be looked at in its context. And we'll come to that. Herbs, patients take herbs. Herbs are good. So you find patients who take herbs. Just giving some couple of examples of some herb-drug interactions, meaning your physician has you on a medication. You are prescribed a medication that you take on a regular basis. However, you don't disclose to your physician that you're taking something, something, a supplement. At work, there's a lot of actually social pressure. I actually equate it to the youth. The youth have a lot of peer pressure. As adults too, we have a lot of peer pressure at work. Everyone is talking about herbal supplements. What supplement are you on? Oh, I've heard this is good for you. This will help with this particular problem, or take it to avoid getting this particular disease. So when a doctor has your medication that you're taking and you don't actually inform your physician that you are taking some herbal supplements, some very adverse events might happen. I'll give you an example. We had a patient who was taking medications for cholesterol. A young lady came in very jaundiced. Her liver enzymes were extremely elevated, but her dose of the cholesterol medication was the lowest dose. So one of the doctors in training, residents, did the admission. We talked to the patient. We ran all tests. Everything came back negative. Hepatitis A, hepatitis C, those are the most, and B, those are the most common causes of acute liver failure. So this patient was in acute liver failure. Her liver was not working, almost 60% not working, and we couldn't really figure out what the matter was. We checked Tylenol levels, those were fine. And a second resident came in, talked to the patient extensively, and got a history. She had recently started some medication that she got from abroad. And this medication was supposed to prevent any viral infections. And lo and behold, we asked the family to bring it in, and we looked it up, and that was the cause of the liver failure. And this patient actually left the hospital with a new liver, because she went into fulminant liver failure. We moved her to the intensive care unit, and she left the hospital with a new liver, simply by taking a medication, which again for her was, she meant well. So St. John wort used to treat depression. It has a lot of interactions with antiretroviral drugs for the patients who are immunosuppressed and who are on immunosuppressants, meaning liver transplant, lung transplant patients, kidney transplant patients. For those patients of us, especially where we come from, we're still using warfarin. Coumadin is another name, a blood thinner. The new blood thinners, are quite expensive, Xarelto, etc. So we use warfarin to treat blood clots. So a lot of interaction with these medications could lead actually to worsening or high levels of warfarin, thinning of the blood, and eventual, quite some bleeding. Grapefruit juice, I'll come to that. Grapefruit juice seems wonderful. Grapefruit, from the grapefruit itself. I'll squeeze grapefruits and eat, and drink the juice. And lo and behold, you're taking a blood pressure medication listed, one of those listed there. Nifedipine or Nifediac, that's another name. Amlodipine or Norvasc is another name. Isradipine. The grape juice blocks the metabolism of those medications. Therefore, they act and stay in the blood for a longer period of time. So with time, over time, your blood pressure gets extremely low because essentially you have excess doses of medication. And a patient with low blood pressure, a lot of bad things can happen, including passing out, loss of consciousness. So something as mundane as drinking grapefruit juice. So grapefruit juice, and you're one of the blood thinners, this is just a sample. You need to realize what medications you're on. And even if you mean well, grapefruit juice is beneficial, but always be aware of interactions. So what is the role of medications? For curing, to ease symptoms, delay progression, and also medications are used at times to diagnose. So curing, you get sick, you get pneumonia, you get a skin infection, you get a blood infection, you get a bladder infection, you go see, you're evaluated by a clinician, you're given a medication, an antibiotic, you take the antibiotic for 5 days, you take the antibiotic for 10 days, you are done, you are cured. Easing symptoms, I have a headache, I have an earache, I'll take something to control my pain and get rid of my symptoms. So if I'm coughing, I'll take some cough syrup. So those are some of the roles of the medications. Absorption. So when we take a medication, not necessarily by swallowing, we swallow medications. You can take medications by inhaling them. So for those of us who have asthma, it's an inhaler you use. But this mostly pertains to the medication that we take orally by mouth. How is the medication absorbed? Typically by the gut, the stomach wall, and also by the liver. And there are a couple of medications that are absorbed actually underneath the tongue. Underneath the tongue, we have a lot of blood vessels, a ton of blood vessels. You put a medication underneath the tongue, it is absorbed directly into the bloodstream, actually without most of it getting to the liver. Eventually it will get to the liver, but you have a quick effect. So if there are any issues with the gut wall, absorption will be delayed. If there's an issue with the liver, also absorption will be delayed. Medications are also eliminated. So whenever they absorb, some of the medication is eliminated. I'll give you an example. For those of us who have low iron levels, low hemoglobin, you might be on an iron supplement. You take the iron supplement either once a day, twice a day, or 3 times a day. Iron is hardly absorbed. Elemental iron is hardly absorbed into the bloodstream. Do I prescribe it? Yes. Do I tell patients to take it? Yes. However, it takes quite a while for the iron for you to get normal iron levels with just a simple pill. So a lot of the iron that one takes is eliminated in the stool. Some of it is also eliminated by the liver and dumped back into the bile, and the bile is dumped into the intestines, and out it goes. So absorption is one of the areas that we have to look at, and anything that hinders the absorption, either pertaining to the stomach wall or the liver, and some of the medications we described prior. All medications actually, once a medication is taken, I don't want to use the word all, majority of medications are passed through the liver, in the circulation through the liver, and the liver has a lot of enzymes that actually metabolize, meaning break up the medication to its active ingredients. So the liver is a very important organ. I like teasing the patients who I see, like which is the biggest, which is the greatest organ we have: the heart, the liver, the kidneys, the brain, etc. I believe the liver is a very important organ. The kidneys, you can live with one kidney, but it also does an amazing job. So the time course of medication effects, we have some immediate effects, delayed effects, and cumulative effects. Most of the scare we have, most of the hesitancy we have in medication might pertain to immediate effect. You take a medication and right away you see the effects. There's some delayed effects and there's some cumulative effects. So a medication that you take, for example, an antibiotic, you'll not have an immediate effect. You take the antibiotic, you have pneumonia, the pneumonia goes away after 1 dose. The cumulative effect of the antibiotic will eventually help you heal. So the side effects that we look at are actually classed under one of these 3: immediate effects, delayed effects, and cumulative effects. And right now I'll talk about the vaccine because that's what is on the news. And what we actually hear on the news so far is the immediate effect. A patient got the vaccine, they went home and they died. That's an immediate, possibly immediate side effect. The cumulative effects so far of the vaccine, for example, we have not, we only have a couple of months behind our back to look at, in addition to the delayed effects. Toxic products, I'll not talk too much about this. Some compounds are transformed to reactive intermediates that are toxic to organs. So you'll take a medication and lo and behold, you keep taking it and eventually you have a toxic product coming out. So I'll jump to the relevance of medication metabolism. So the biggest thing I would like for us to take out of this, you've had individuals, I'm scared of taking this particular medication. I heard about this happened to my friend or a neighbor or a family member. We have different genetic makeup, each one of us, even siblings from the same dad and mom. And that influences our enzyme levels in the liver used to metabolize drugs. So genetic factors are very important to medication metabolism. So each one is unique. All of us are very unique. And there's nothing we can do about genetic factors. There's nothing we can change. Diet and environmental factors, yes, we can change our diet. We can change our environmental factors to an extent, but not so much. Age, that's the same thing. Drug interactions, we can also change that. I'll give you an example of genetic factors. Vitamin C on its own is actually something very good and which we all should take on a daily basis in the form of fruits. And for those of us who don't like fruits, we can use a pill. It's always good to use the natural form of medication. So vitamin C, take fruits. Two individuals might be taking the same amount of vitamin C, but an individual might develop kidney stones from excess vitamin C. Very rare, but actually it happens. And vitamin C, for example, it's a water-soluble vitamin. So you take a lot of vitamin C, you'll eliminate it in your urine. Typically, just you eliminate it in your urine. But if you get to almost 100 times the levels of vitamin C, then you get into trouble. And one of the issues patients have are kidney stones. But you can take the same amount of vitamin C, two individuals from the same family, and one will get kidney stones and one will not. Diet and environmental factors, that also comes into effect, and those are things we can particularly look into. Before I go to questions, in general, I would like you to take home my take-home points in terms of medications and your body. Each one of us is unique. We shouldn't use someone else's, for example, drug interaction or interactions or adverse effects of medications to our own circumstance. And my take is, I believe in what is in the environment, in what the world, what creation has for us in terms of keeping us healthy, and when we're sick, using whatever we have in creation to make us better. However, at times, a time comes when we need to use, maybe even for a short time, conventional medication. Patients come in with blood pressure of 240 over 150, and they've been using, some of the herbal supplements. And with time, you find that the effects either wear off, and they come in with extremely high blood pressure with some symptoms. And they don't want to take medications, either because of hesitancy or just they plainly do not want to take medications. But look at your health. There are always alternatives. The hospital that I work at, we actually have a center for holistic medicine. So for the patients who are hesitant in taking a medication, we actually have a center where it's actually run by a Seventh-day Adventist physician who is part of our medical group. So the hospital, if someone doesn't like taking medications, actually refer them to this center where you can get all your questions answered and you can actually get treated appropriately. So I'll stop here and give time for questions.
Peter, I am grateful for the presentation that you've made. But I think there's one other aspect that needs to be stressed, that lookalike symptoms are not necessarily meaning the same disease. So people should not share medications for similar symptoms unless they've received the diagnosis. If you can elucidate more on that, that would be a good idea.
Sure. So thank you, Dr. Wisibisia, for bringing that up, Balozi Wetu. There are a lot of patients who come in and they're not forthright, or they might be forthright. And sharing of medications is a very common problem, a very common occurrence that we see. My aunt, was short of breath, and I have asthma myself, for example. Well, auntie was short of breath, and I gave her my nebulizer, my inhaler. Every disease or process or symptom that looks like what you think what you have is actually not the actual disease. It might not be the actual diagnosis that you have. So I would be very weary. I would actually counsel everyone against sharing medications. As I mentioned, each one of us has our own genetic makeup. So a dose of 10 milligrams of a blood pressure medication might be too much for for my aunt, or might be too little. A dose of insulin that's given to, my cousin might be too much for, my nephew. So each one of us is unique, and we need to seek medical attention and get the appropriate care. So I would not share medications whatsoever. All right, I have a question here. What is the right number of meds one can take without worries of serious interaction? I had a patient last week who came into the hospital, and when the patient comes in, we go through the medications. She had 45 medications, 45 total medications she was taking at home, 45. And she was essentially a walking pharmacy. So definitely there were interactions. So the symptoms that she came in with were all from the interactions among her medications. So when she left, she only left with 5 medications. I took away 40 of them. She did not need 40. So there's really no one particular number, I would say, as a total number of medications one should have. Once you start getting above 10, 8 to 10, this is just again, there's no research on this, but once you start getting to 8 medications, 10 medications, 12, go to your physician and sit down and discuss, do I really need this? Do I really need this particular medication? Can I be weaned off? So there's really no one particular answer, but there's some medications we absolutely need. The diabetic, either, once we require insulin or not, you cannot, do without the insulin, especially for the type 1s, which again occurs at any age. I've seen a patient who is 50-year-old and comes in and their body cannot secrete any insulin, so they need insulin. So you need to sit down with your physician and go through each medication, and the ones you do not need, stop the medications. I have one other question. I hope that answered the question. Advice for people taking ginger, garlic as supplements. They're great. They're great. Again, we do not have a database for all the side effects. Again, it goes back to the regulation. The vaccines, for example, I'm just going to use them. All side effects that we have. And for those of you all my patients ask me, Doc, are you vaccinated? I just want to let you know I am vaccinated. Any symptom we have to report to our employee health here, who reported to the CDC, etc. But for ginger, garlic, no, there's no reporting. It's only case studies, meaning a patient came in with this particular condition, and lo and behold, we diagnosed this patient with this side effect because of the ginger. Ginger is great, garlic is great. I know ginger, actually we use it on one patient because we read a case study. A patient with severe nausea and vomiting. We tried everything in the hospital, everything in a in our armory, and nothing worked. So again, this resident doctor in training, we said, why can't we use ginger? So we actually went and bought ginger, and ginger stopped the nausea and vomiting of this patient. So I think in moderation, ginger and garlic are great. I believe garlic has been shown to decrease the incidence of colorectal cancer, but there are mixed studies. Some say it does decrease the formation of adenomas. So colon cancer starts with a small growth, but studies have shown that some studies have shown that garlic actually decreases the rate of colorectal cancer. So I have used ginger actually in the hospital on a patient, as you've heard, and garlic, I have no issues with those, and the interaction really with medications is extremely low. Another question, do you think not liking to eat something is a sufficient reason to change to supplement? Absolutely not. But we live in America. My patient just yesterday told me, Doc, what are you saying? My pressure is high, but not that high. I said, well, your pressure is actually not that high, but I would encourage you to walk as much as you can, take some walks, cut down on your salt, especially chips. He was eating a lot of chips. He told me, and many of my patients say, Doc, I'm not going to give my chips. I'm not going to give my chips. I'm not going to give them away. Just give me a medication. I'll keep on eating my chips, but give me medication to control my blood pressure. So not liking to eat something, that's not great. Right now we have a challenge, me and the doctors in training, we have a challenge of who will eat 3 vegetables in a day, including breakfast. Kula mchicha asubuhi. 3 times a day, 3 times, for vegetables. This thing of, eating bread in the morning and eggs. So that's our challenge that's going on, and we'll see who will win. So no, not liking to eat something is not a sufficient reason to change to a supplement. I think there's a hand raised. Any other question for me?
Hello, can you hear me?
Yes, we can hear you now.
Oh, sorry. You had mentioned something here really quick about the garlic and the ginger moderation. I think one of the challenges that we have that maybe tungeweza hata kuzungumza hapa ni when you are using supplements, especially in natural supplement, we really don't know how much of that's supposed to help us treat what condition we think we're treating. And sometimes wagonjwa wanafikiri it'll be the same thing with the regulated medication. I think that's a serious point kwamba they find themselves in a toxic level. Sema unaweka kijiko kingapi cha ginger kwenye kikombe cha chai? Oh, just 1 spoon. Then, or maybe 2 spoons. And then akichukua vidonge vingine kama digoxin, Tylenol, they think the same way kwamba the more the volume of medication I have, my condition will disappear, which is very, very, very dangerous. Over huku kumbe ni dosage. So whatever doses they give you, they have checked your weight, they have checked how much you need, and that's all you can take. Don't take it just like it's a supplement, because then we're getting in a toxic level where we can see more dangers. I don't know if you have seen that in your practice and what you think about that.
So thank you, Mr. Chairman. This is very true. And patients think the more the natural remedies they take, the more the better. We've actually seen a patient with vitamin A. It sounds good, vitamin A, vitamin B, C. The more they take, the better. So she took a ton of vitamin A because, the more the better. And lo and behold, she turned out to be pregnant, and her kid was born with congenital anomalies. Quite deformed because of, again, vitamin A, a very good and naturally occurring substance, but taken now as a supplement and taken in excess, and then this happened to the child. I have so many instances I can go through. Vitamin C, being one of them. Multiple admissions with kidney stones. And the last time this patient came, I talked to my team, you know what, let's send this stone for an analysis. And lo and behold, there are different stones, kidney stones. We have, cholesterol stones, calcium stones. We sent the stone for analysis to the lab, and lo and behold, to the vitamin C, just vitamin C, multiple stones. So a very innocuous and a very innocent medication or supplement might turn out to be extremely dangerous. And the same thing, do not double your dose, triple your dose of any prescribed medication or even over-the-counter medication. I have many liver stories. I can tell you so many stories about liver with pain. Doc, you know what? My back was hurting, so I just kept taking Tylenol more and more and more and more. And they came in again with fulminant liver failure, big time liver failure from Tylenol overdose, an unintentional overdose. They were in pain, so they doubled and tripled and quadrupled the dose. So I wouldn't go up even on over-the-counter medication. Look at the insert; it will tell you how frequently to take it, and adhere to that. There's a question: does it matter from which country a medication is made? India, USA, England, etc. I'll answer that. Most of the medications we use in the US are actually made in India. You come in with a bladder infection, an intra-abdominal infection, appendicitis, etc. The antibiotics that I'll be giving you are actually made in India. Ciprofloxacin we use here is made in India. Ceftriaxone that we use here, similar that we use back in Tanzania, most of it actually comes from India. So really the medication, does it matter? Yes. The USA is extremely strict in the quality of medication. And what is allowed in here is extremely taken a very good look at. So I trust the process of the medications we use here. The other countries, I am not sure. So patients come in with a medication, I'm like, I cannot really guarantee the efficacy and what the milligrams tell you, or even what is in the medication. I cannot guarantee you what is in there. But the US process in terms of actual medication is quite rigorous. And to get a medication on the market is very tough in the USA. Another one, genetics and genomics affects our metabolism of medications. What do you think drives off the label usage of medications? Gabapentin, for example, is being used for depression. And that's a very important topic and a huge topic that we can spend hours talking about. And the future of medicine, where we are headed now, is eventually I'll come in sick and they'll take my genetic makeup and they'll tailor treatment to my genetic makeup. That's where we are headed. We're already doing it in, for example, lung cancer. They come in, they take genomics, and they tailor the treatment based on your genetics. So off-label use of medication, gabapentin, Neurontin, for example, is typically used to treat sometimes, indication seizures or neuropathy, pain in the fingers and toes that you have. Off-label use, of gabapentin for depression, I wouldn't go there. I wouldn't recommend that for the off-label use of gabapentin for depression. I think we have quite a number of naturally occurring foods, nuts, etc., that we can use for depression. And Loma Linda La Sierra has a very good program in terms of depression. And I've actually sent some patients there and who are off all antidepressants right now after attending the program in Loma Linda and La Sierra area. I hope that answers your question.
Peter, can I please supplement on your answer on the place of origin for the medications? It's a good question, but I think we all have to remember that drug manufacturers comply to a certain formula for a given molecule that makes up that drug. Because of the labor and market forces, India is the cheapest source, followed by China and other countries. So a mere fact that a drug is coming from India does not necessarily mean that it's inferior, though the packaging is different. And because of the markets to which these medications are sent, sometimes the bottles or cartons are labeled, should not be sold outside of the US, should not be sold outside of India, or this is for Tanzania or East Africa or whatever. The content is the same. And this can be proven very well when you look at antiretrovirals. The amount of money that America pays for 10 cartons could be 100 times the amount of money that African countries or sub-Saharan countries pay for the same drug, the same molecule, because they are made by the same factories, the same machines. Now, what we are supposed to be careful about is where these medications are obtained from. If you go to a place like DRC, Goma, sometimes you find people peddling antibiotics by the streets. There was a time even in Dakar, Senegal, people would sell antibiotics by the streets, and many other countries in the third world. Now, those are the places where none of us should go there and get such medications. The beauty about getting medications from authorized outlets is that those medications have been vetted, so to say. Like the drug regulatory authority for that particular country has verified the source and the process. Like I can talk of Tanzania because I know how everything is being done. Our drug and the medications regulatory authority visits those factories to ascertain that what they say is exactly what they are doing. In that way, those medications will be equipotent. They'll have the same effect whichever country you find them. Now, if you go to a place where people do not follow those guidelines, then naturally you're going to be prescribed, you're going to be given fake products with very, very bad consequences. This has happened in Africa. I know of a story that led to a few deaths in Nigeria, and the reason why Nigeria decided to intervene. Number two is that the process is not once for all. It's done several times, and batches are picked randomly around the supply chain to ensure that the quality is sustained. So that is one thing I wanted to stress on response to the question that Lea Manongi had presented. Thank you.
All right, I think there are two more questions, and I think my time would be up. Do you think we can expect the future that we can get the cure for cancer once and for all? Any discussion for this in the medical field? I think we have made quite advances in the treatment of cancer, specifically lung cancer. The survival is actually quite impressive with all the new medications that they have, again, targeting patients based on their genetic makeup. For example, I have two patients who came in, smokers, and that was 4 years ago with stage 4 lung cancer spread. If this was 10 years ago, I mean, within 6 months or so, they would be gone. But they're still alive. One of them actually, both of them still go out and, cut their grass in their lawn. So amazing, with stage 4 lung cancer, still living a very decent life. So a lot of research is going into cancer, specific type of cancers. But again, it is promising. The main thing, whenever I talk about cancer, I say cure. I mean, prevention is better than cure. All of us go see a doctor for the regular checkups. For those of us who are ready to go get the colonoscopy to catch colorectal cancer screening early, prostate cancer, breast cancer, just go for the regular screening. So prevention, I think, is better than cure. One more question. Getting body aches and pains because I'm coming of age. All of us, getting, as we advance in years, wear and tear on all our joints. We have a huge spine, our back, we have knees, knees, hips. It's after time, think about a car and the tires. There's wear and tear. So getting the pains, that's something natural, but the main treatment is keeping active. That, I believe, those are the questions that I have. Unless there are any additional questions, let me know.
Nafikiri kufikia hapo tumefika mwisho wa kipindi hicho ambacho tumeletewa na Dr. Peter Luyeho. Kwa niaba ya Tausi, nipende kukushukuru Dr. Peter kwa presentation hii, na Mungu akubariki kwa kazi.